Jeffrey, take one.
Okay, my initial diagnosis was I had squamous cell cancer. It was actually at the base of the tongue and had already migrated over into my lymph nodes. It was one of those I noticed a large lump on my throat and decided to have it checked out because I thought it was just a sore throat. And so once I received the diagnosis, it was, it's one of those that you're in shock. I mean, you always think, okay, it's strep, it's something else. And then it's the realization that you have it, and how do you respond to that? And for me, it wasn't so much what do I do, it's like, what about my family? And thinking about them first, and then go, okay, what do I do to fix this? How can we make it go away, if you will? And so it was fairly aggressive at the time that I had found out, and looked at the usual avenues, I guess, more traditional medicine, and was somewhat startled by the aggressiveness of it, and kind of being told we can give you a fair quality of life for 10 years and then we'll take it from there. So it was being told that, go out and have a good meal because you're going to have to remove your teeth. We're going to, might as well get a feeding tube in right away. Let's get you fitted for a metal mask so we can start radiation. It's one of those you just question yourself, what kind of quality of life is that? You won't have taste, you won't have speech. You'll probably lose your ability to speak, so you have to go to a speech therapist to relearn how to talk. And so you just, there's a lot of things that go through your mind. And one of them, do I even want to go through that? What is the quality of life for that? But then you take into consideration your loved ones around you and you say, okay, I'll take a look at it. I think the fortunate thing is I was going to a chiropractor and food therapist who was helping, and she happened to actually know Dr. Von Schaefer. And I confided in her what my diagnosis was, and thus she responded telling me about her. And the research I did didn't look promising doing the more traditional methods because it was more along the line that after probably about 5-6 years you'd have to have jaw reconstruction. So it just would continue to decline. And then you'd possibly get to repeat it again. And so I wanted to check out all avenues. There's more out there than just traditional medicine. And it doesn't take much research to find that out. It's just to find the right person or the right group. And so I, that same day, went to the cancer center and saw Dr. Von Schaefer. And it didn't even take a short conversation, and understood what other options, viable options, that could be used to help treat and possibly eliminate the cancer. And so we started actually the next day because it had gotten so aggressive. It had moved around to the second and third lymph node, and I could feel the pressure against the carotid artery, just pushing against it. So I knew it was a matter of time. We started the treatment and was very aggressive with it, and I followed every detail that was with it. I think one of the key things that I learned right away is you have to be your own advocate and educator as well. You cannot just hand it off to somebody else. This is a you know, doctor's going to be there to help you, but you have to help yourself as well. This is not something you just are along for the ride. You control the ride. And so I did. And fortunately, we were able to, within a year, have it to where the PET scans revealed nothing was there.
Wow.
And we were aggressive with the IPT treatments, followed with some of the other medicines that she researches extensively, and helped put together the right combination. And it was really powerful and impactful how you could feel the changes coming. You know, of course, there's going to be days it's just like, you know, you don't want to get up, but you know, you're not in a battle, you're in a war, and your whole objective is don't let it win. And so that was one of the key things that just kept me going. And it was, I don't know, it was how the relief, you could say, as you really get in tune with your body, and you can really sense how things are going. And so it's one of those, you could almost feel the hope and everything growing in it, and as far as when my body was taking back over. So it was good. And so we continue on finding the underlying cause. Cancer doesn't just pop up by itself. There's many things that attribute to it, whether it's the environment, the genetics, what have you. And mine is an underlying virus, which we are treating. And, you know, I feel better than I have in many, many years. It's one of those I didn't even realize the downhill that you're going. You just kind of feel aches and pains now and then, and you don't really understand what it is. It's just, you know, people say, oh, you're getting older, you're this, you're that. And you really have to be more in tune with your body to understand it's not just that. And I think that's one of the key things that I've taken away from it is listen to your body more. And I think that's been a benefit to help me through this whole challenge. Before I had cancer, you know, you could see it on TV and you just, you know, you have the empathy for it. But until you actually have it and understand it, you just can't really come into a true understanding of it. And the way I feel about it now is, you know, I definitely want to be an advocate and help people out to understand it's not a one-size-fits-all. There are more methods out there that truly help people, me being one of them. And, you know, look at your options. Don't settle. This is one thing, one time you should not settle. It's your life. And you're in for the fight of your life. So give yourself the best chance. For me, it's more than just a bedside manner. I mean, with Dr.V, it was definitely when she needed to get stern with me, she would. It is what it is. I respect that, and truly could understand when I looked at her, I could see the devotion, the amount of energy she was putting in it to truly figure out how to cure me. Not, here's one of my 5 flavors, pick one. It was, here's what I think the course of treatment is based on you, based on your genetics, based on what we're finding. And, you know, that gives you the level of confidence to where you can take direction from her and say, okay, what else do I need to do to be successful with this? So compassion when necessary, and understanding that, you know, you've got a huge role to play in this. This isn't not along for the ride, and you've got to listen. So, when I saw that, it was kind of an easy choice.